So have you heard this term, weight loss peptide? Well, stick around because we are going to talk about it. Hi, and welcome back to my channel. My name is Dr. Megan. I am a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel is your trusted source for evidence-based answers to your weight questions. So thank you so much for watching. Today, we are going to talk about this term, weight loss peptides, because I've been hearing a lot about it on social media and it sounds very mysterious and magical, and I wanted to break it down a little bit for you so you know what people are actually talking about. So first of all, let's talk about what is a peptide. So before we get to peptide, we have to talk about amino acids, which are essentially the building blocks of life in our body. They are these molecules that are essential to life as a human. And if you have a short string of amino acids, that is called a peptide. And if you have a much longer string of amino acids, or if you have a couple strings that are put together in various configurations, that is called a protein. So a peptide is really just a precursor to a protein. So if someone is saying, I'm on a weight loss peptide, that's similar to if someone was saying, I'm on hormone therapy, but they're on a birth control pill. Or it's similar to someone saying, I'm on antibody therapy, but they're on Dupixent for their atopic dermatitis. Yeah, you could say that, but it's way more important to find out what the hormone therapy is, what the antibody therapy is, and therefore what is the peptide therapy. So usually, I'm guessing for most of these people who are not my patients, but when they say weight loss peptide, what they are talking about are FDA-approved medications such as Wegovy or Ozempic, which are also known as semaglutide, Saxenda or Victoza, which are also known as liraglutide, or Mounjaro, which is also called tirzepatide. If they're not talking about FDA-approved medications, then I would really want to know what they're talking about, and I would be very suspicious of it because it's probably not any sort of regulated medication, and you should be careful. So really, the question, if someone's on a weight loss peptide, the magic is not in the fact that it's a peptide, but the real question is, well, what is this medication? What are you taking? What is the exact compound? Because while peptides, they do have some, benefits in terms of absorption and their mechanism and how they move through the body, that's not the whole story. There's nothing magical about peptides. We use them all the time in different medications. So it's not really the fact that it's a peptide that is causing the weight loss, but more importantly, the fact that it's this one particular type of medication that happens to be a peptide that works in this very particular way to produce these results. So proceed with caution, ask questions, ask what this person is on. So I hope that's helpful, and I hope next time you hear someone talk about a weight loss peptide that they're explaining exactly what they're taking and they're not relying on this term peptide to confer some sort of magical component to whatever they are on. So I hope this was helpful. Thank you so much for watching, and please be well.